Here are the structures that you need to know. So I've talked about, so this is a sagittal section, obviously. I talked about the cornea, okay, clear window at the front of the eye. There's the lens. It's clear when you're your age. Later on, it becomes cloudy. That's what a cataract is, okay? And you've got the iris here, which is sort of in a sagittal section. The hole in the middle is the pupil. So this is the focusing part of the eye that I talked about. So we call this the anterior segment, the front part of the eye. So cornea, anterior chamber, iris, pupil, and lens, okay? Obviously, you've got lids and lashes out here too. The cornea becomes the sclera, okay? It's continuous fibrous tissue. Anteriorly, it's clear. The sclera is white, so a different structure, but it's a continuation of the cornea. So the sclera forms the hard fibrous shell of the eyeball, which gives it its structure. You've then got the posterior segment, which mainly consists of the vitreous, which is like a gel, a jelly type structure inside the eye. And at the very back of the eye, you've got the macula. The central part of the macula is called the fovea. So you've got retina. The center of the fovea is the macula. The center of the macula is the fovea, okay? And so that's responsible for your high definition color vision is your central macula. So that's a very important structure. The macula then sends fibers to the optic disc. The optic disc is the cable to the brain, all right? So front to back, they're the bits that you need to know. What have I missed out? I've missed out choroid. The choroid is a continuation of the iris. So the iris at the front, which gives you your eye color. So when you talk about someone's eye color, you're talking about the color of their iris, right? The iris is a pigmented vascular structure, and it continues posteriorly as a pigmented vascular structure called the choroid. The choroid sits beneath the retina. So the retina is a light sensitive nerve layer, and it's supported and nourished by the choroid, which sits underneath it. And it's the retinal cells which basically transmit towards the optic nerve and become the optic nerve, which then sends a signal posteriorly. So spend a little bit of time on that diagram and get familiar with those structures so you can name them, say, in a multi-choice question. So when you look at someone's eye, this is what you see. Basic stuff, upper lid, lower lid, okay? Medial canthus, the nasal side, lateral canthus, the temporal side. What's conjunctiva and what's sclera? Well, if it's white, that's sclera. The conjunctiva is clear epithelial cells sitting on top of the sclera. So unless you look really closely, the conj, in a way, is invisible. If you're looking on a slit lamp, you can see it, obviously. And if you put topical anesthetic in someone's eyes, okay, anesthetic drops, take a sterile cotton tip, you should actually be able to move their conj over their sclera because it's fairly mobile. So when you do your clinical skills workshop, you should do that on each other. Put anesthetic drops in, take a cotton bud, and just gently move, don't poke each other, gently move the conj around on top of the sclera. Conjunctiva has blood vessels in it, so you'll see those blood vessels moving over the white, okay? So over here, what's the most anterior structure? I've got iris, pupil, and cornea. So what's the frontmost part of all that? Yeah. So the cornea in this photo is really only visible as this light reflection. This is the camera that took this photo. Okay, it's the flash from the camera that took this photo. So the cornea is clear. It's the only tissue in the body that's transparent. How do you have cells with organelles that are completely transparent, millions of cells? That's a topic for another lecture, but I think that's pretty amazing. The iris we've talked about, that's the colored part of the eye, and then a hole in the iris, central gap, is the pupil, which obviously can constrict or dilate. What's behind the pupil? What's the very next structure behind the pupil? You remember that sagittal section that we looked at? Any guesses? Lens, yep. Is that the same person? I can't see where that's going. Okay, someone knows their eyes. Well done. So the lens is right behind the pupil, and that's part of the focusing mechanism, okay? So here's another sagittal section, just to give you another view, okay? There's the cornea, here's the iris, all right? And the clear bit in the middle is the anterior chamber. It's filled with what we call aqueous humor, or basically salt water, essentially, biological salt water. Aqueous humor is created by the ciliary body, which is also the posterior extension of the iris, but creates aqueous humor and pumps it out into this little area, which is called the posterior chamber. And the aqueous humor then enters the anterior chamber, fills the anterior chamber with clear fluid, and drains out through something called the trabecular meshwork. So that's a flow of fluid within the eye, okay? It's like the irrigation system of the front part of the eye. There's a lens sitting behind the iris. This gap here is the pupil, okay? Here's another view of that. So there's our lens. There's the ciliary body. Here comes the aqueous humor and travels out around the iris, drains into the trabecular meshwork. The trabecular meshwork is at the junction of the iris and the clear cornea, okay? Now, what do you think would happen if the iris got stuck to the lens? Just think about it logically. You've got fluid getting pumped out here, this gets stuck to this. What's going to happen to this fluid? Yep, it's going to accumulate underneath the iris. So now you've got basically a closed space with fluid which is continuing to accumulate. What's that going to do? It is going to increase intraocular pressure. It's like if you're filling up a balloon, basically. And so that space is going to get tighter and tighter and tighter. The other thing it's going to do, it's going to push the iris forward. The iris pushing forward is then going to shut off the trabecular meshwork, which is going to push the pressure up even more, okay? So that's what, if you've heard of acute angle closure glaucoma or closed angle glaucoma, that's what that is. So